Welcome to my YouTube channel. Today we are going to talk about neonatal conjunctivitis. Neonatal conjunctivitis, just from the name, meaning neonatal during the first 28 days of life, and conjunctivitis, meaning that is the inflammation or infection of the conjunctiva. So it's also called ophthalmia neonatorum, which is an eye infection occurring in newborns within the first 28 days of life. So this is a serious condition because it can lead to permanent blindness if left untreated. So this condition is usually caused by bacteria most commonly. However, it can be caused by viral or chemical agents. And in terms of bacteria, it's usually Neisseria gonorrhea and Chlamydia trachomatis are the most dangerous infections. Causes of neonatal conjunctivitis. We'll start with the chemical conjunctivitis, or also known as the sterile conjunctivitis, and this one is usually caused by silver nitrate drops or other chemical irritants which are used for newborn eye prophylaxis. So the onset is usually within the first 24 hours after birth, and the symptoms usually include mild eye redness, irritation. However, there is no pulse. When you see plurulent pus discharge, always think about bacterial infection. So treatment, this one is usually self-limiting and usually resolves 24 to 48 hours without specific treatment. So bacterial conjunctivitis, which can be divided either to gonococcal, chlamydia, or other bacterial infections. So in here we are going to cover the gonococcal in conjunctivitis. So gonococcal conjunctivitis, the bacteria behind this is the Neisseria gonorrhea, and this is the most severe form of neonatal conjunctivitis. The onset is usually 2 to 5 days after birth, and the symptoms usually include profuse, thick, yellow-green purulent discharge. You can also have severe eyelid swelling, that is ecthymosis and edema, conjunctival injection, that is intense redness, and corneal ulceration, which can lead to blindness if left untreated. Diagnosis is you can do gram stain, which will show gram-negative intracellular diplococci. In addition to that, you can do culture, that is Theiamata agar, which confirms Neisseria gonorrhoeae. So treatment of Neisseria gonorrhoeae or treatment of gonococcal conjunctivitis, you use systematic ceftriaxone, that could be either IM or IV, or ceftriaxone to prevent systemic gonococcal infection. In addition to that, in the eye, you can also do saline irrigation or erythromycin ointment for local infection. Complications usually include, because we stated that you can also have corneal ulceration, which will lead to blindness if left untreated. So that is one of the complications, that is corneal ulceration and perforation, which will lead to irreversible blindness. In addition to that, the infection can spread to systemic, that you could lead to disseminated gonococcal infection, which will present as sepsis, arthritis, and meningitis. Chlamydia conjunctivitis, which is caused by Chlamydia trachomatis, and this is the most common cause. We said in gonococcal that is the most severe cause, whereas chlamydia is the most common form. So the cause is Chlamydia trachomatis and stereotypes, that is D to K, from an infected mother genital tract. So onset is usually 5 to 14 days after birth, and it usually has delayed onset. So the symptoms will present with a watery discharge initially and later will become a mucopurulent. It is usually called mild to moderate eye swelling. You can have conjunctival redness. It's usually associated with chlamydia pneumonia, that is cough, and usually there is no fever. So diagnosis, you can do game sustain, which will show intracytoplasmic inclusion body, or you can do NAT, that is nucleic acid amplification test, which is the gold standard of PCR. So the treatment, oral erythromycin, that is 50 mg per kg per day for 14 days to treat both the eye and the lung infection, or you can just do topical erythromycin ointment only for local symptoms and not enough for systemic infection. So the complication, just as gonococcal, you can also have corneal scarring, chronic conjunctivitis, and chlamydia pneumonia, which usually occur in 10 to 20 of the affected infants. Other bacterial conjunctivitis. Other bacterial conjunctivitis usually include Staph aureus, Strep pneumoniae, Haemophilus influenza, and Pseudomonas aeruginosa. The onset is usually variable 3 to 14 days, and the symptoms usually include mild mucopurulent discharge with moderate redness, and eye swelling. Diagnosis usually culture from conjunctival swab, and the treatment is usually topical antibiotics, e.g., erythromycin, tocomycin, tobramycin, and ciprofloxacin. Complications are usually mild and rarely leads to corneal damage. One thing you need to note in bacterial conjunctivitis, when you have gonococcal and chlamydia, you have a higher chance of you developing corneal scarring, and which can later lead to, or corneal scarring and ulceration can later lead to blindness. And we say that gonococcal is the severe form, while chlamydia is the most common form. So viral conjunctivitis, which is the most common, is herpes simplex virus, that is HSV. Other causes is herpes simplex virus 1 or 2 transmitted from an infected mother during the delivery. The onset is usually 6 to 14 days after birth. The symptoms include watery discharge, that is serous, presence of vesicle on the eyelid, and this is usually a classical sign of HSV. You can also have corneal involvement, that is keratitis. It can lead to systematic herpes such as encephalitis, sepsis, or pneumonia. Diagnosis, you can do Zactile smear, which will show multinucleated giant cells. In addition to that, you can do PCR or viral culture, but just do PCR, which confirms HSV. So the treatment, because this is viral, you do IV acyclovir for systematic disease, or you do topical trifluridine or ganciclovir for eye infection. Complication, as you've mentioned before, you can have keratitis, that is, which could lead to corneal ulceration, which will later lead to visual loss, or you can have systemic infection, which will lead to hepatic encephalitis, which has a higher mortality if not treated. Pathophysiology of neonatal conjunctivitis. Infection usually occurs during passage through the birth canal or exposure to contaminated hands while handling the baby. This will later lead to viruses or bacteria usually attached to the conjunctiva, this triggering inflammation and redness and discharge. In severe cases such as gonococcal and chlamydia and herpes, which you have mentioned, the infection can spread to deeper tissue leading to corneal damage, ulceration, or systemic infection. Diagnosis of neonatal conjunctivitis. We have history and a clinical examination. The time of onset is very key because it will help you differentiate the cause. Such, for example, when we say chemical conjunctivitis, usually few hours after a birth, while let's say chlamydia is usually has a delayed onset, gonococcal is 2 to 5 days, and so on. Type of discharge, we say purulent discharge usually points to bacterial infection. However, you can still have watery and thick and etc. Maternal history. Is this mother, did you take a good maternal history? Did she has STIs? Did she has vaginal infections? Laboratory tests. You can do gram stain and culture for gonococcal conjunctivitis. You can do GMSA for chlamydia, which detects inclusion bodies, as you have mentioned before. You can do PCR for chlamydia and HSV, which is very highly sensitive, and you can also do Zac smear for HSV, which usually detect multinucleated giant cells. So treatment of neonatal conjunctivitis, we already talked about the treatment in when we were discussing about the cause, and we said in chemicals, which is caused by silver nitrate, the onset will be less than 24 hours, the type of discharge will be watery, and the treatment usually self-resolves. The cause of gonococcal, that is gonococcal conjunctivitis, is usually Neisseria gonorrhoeae. The onset is usually 2 to 5 days. We say this is the most severe form, and the type of discharge will be profuse, purulent discharge, and the treatment will be IM ceftriaxone plus saline irrigation. Chlamydia trachomatis, we say this is the most common form, and the onset is usually 5 to 14 days, which is usually delayed. The type of discharge usually starts as watery and then goes to mucopurulent. The treatment is usually erythromycin. The bacteria, that is other bacteria including strep, and H influenza, the onset is usually variable, that is 3 to 14 days. The type of discharge is usually mucopurulent, whereas the treatment is usually topical erythromycin or tobramycin. And then when you go to viral, we say that it's usually caused by HSV1 and HSV2. The mode of or type of onset is usually 6 to 14 days. The discharge is usually watery, and the treatment is usually IV aceclofenac. However, you can also do tropical trifluridine. So the prevention of neonatal conjunctivitis, you screen and treat pregnant women for STIs before delivery. You give erythromycin or tetracycline ointment at birth. This is for prophylaxis for gonococcal and chlamydia infection. You avoid unnecessary sylvanate draw to prevent chemical conjunctivitis, and cesarean delivery for mothers with active HSV. Thank you.